Firstly, you must be very aware of the growing issues of traumatic brain injuries in football.
Yeah, I think we're all aware that this week, the English FA, in conjunction with the Scottish FA and the Northern Irish Association, that they've introduced some new regulations around heading within soccer, around not introducing heading, allowing youngsters under the age of 12 heading the football. Again, on the back of recent studies that have shown that professional footballers are possibly at a higher risk than other people in the other members of the population. So yes, it's hot topic at the moment. I think we need more research, but again, we can't ignore the fact that some research, as like we said, has shown that there is an increased risk from if you're a footballer or have played football in all your life, that you are an increased risk of maybe having some kind of traumatic brain injury.
Your time both as a player and as a medical professional in the world of sport, have there been any times when you've seen maybe firsthand or experienced firsthand when there's someone's been suffered from a traumatic brain injury or been a risk of one?
Yeah, I think what I need to get across is that the way that we manage traumatic brain injuries today is a hell of a lot better than what it was maybe even 10, but certainly 15, 20, 25 years ago, if not 30 years ago. So we have become more aware of it. Looking at the sports that are leading in it, the likes of the NFL, rugby, and football are getting better at dealing with injuries sustained during playing the game, whether that's an organised game or in training, and the professionals around the game are have a better understanding of signs and symptoms and incidents and mechanisms that cause traumatic brain injuries. But again, that's just at the elite level. It's not at grassroots football. It's not at Sunday football, and these people aren't trained in that. So we have an issue around educating lay people and people in general population around what happens when people sustain traumatic brain injuries, or what the signs and symptoms are.
It seems to be more of a talked about issue these days with new research and stuff like that. How serious, though, is the issue of traumatic brain injuries within football?
Great question. I think that's a difficult one to answer when at the moment there is no direct research, or there's no current research directly linking heading a football when you're young to actually a direct correlation to traumatic brain injuries when you're older, or the sign of dementia. The research shows people that played the game a long time ago headed lots of footballs that weighed a lot more than what they do today, where there wasn't structure in place for grassroots football and junior football. So the game's changed a hell of a lot, but that's not to underestimate the fact that at the end of the day, we don't know the effect of heading a football. And I think that's what everybody's after. Everybody wants somebody to say, this we do know, these are the facts, and it's undeniable. And so we're going to make a change, but they don't at the moment. So there is no evidence around that, and people are just making assumptions. So that's a dangerous thing. But again, we've got to take note. And as you've seen this week, is that associations are taking note and making adjustments in junior football. It's going to be interesting to see what our governing bodies, which is UEFA and FIFA, do. But at the moment, we're just waiting to see what they say on the subject.
And you mentioned the changes introducing, so no longer introducing heading into training for junior players. Is that something that could prove to be effective? Is it a positive change, or is it still a bit of a hit or miss situation?
I mean, well, the it's going to be interesting, because how do you quantify how that affects the game? Does that mean we're producing players that can't head a football? So from a technical element, I think if you look at the game in a whole and look at some of the research that UEFA and FIFA published around the technical side of tournaments and the game, how important set pieces, headers, this skill itself of heading a ball are often considered, match winners and decide football games, which is an integral part of the game. So banning it from a young age or not introducing it into training is a difficult one, because it's not been done before. It's going to be years and years and years before we can test whether that has any influence. You've got to test people throughout the stages of their life and see what that impact heading a football does. You've then got to quantify it. Who's going to count how many headers these kids have done? So there's a long way to go, but I think the first steps is that these new rules are going to be introduced, and then we're going to have to see in years to come whether that has what effect that does have on the game, whether that's from a technical point of view or from a medical side of things.
Do you feel there's anything currently that could be put in place to maybe combat these issues, or anything that could just prove to be a slight positive change in the step in the right direction?
I think what we've got to get better at, what I want to see working in elite sport, is I want to see as getting better at making a definitive diagnosis. Again, in football, we are given 3 minutes to make a head assessments. Rugby's slightly better. They've got the HIA where they can take the players off for a certain amount of time. In football, we don't get that time. We have to make a decision on in 3 minutes when we're on the pitch. I would like to see a tool that gives us a definitive guide to a player being concussed or not. And currently we don't have that. There are no standard protocols out there that will give us a definitive answer. And I think from the medical side of things, I want to see that's where I want to see the game going, is that we can do that.
From a media perspective, there seems to be, research has shown there seems to be a mix of positive and negative views on how the media do cover traumatic brain injuries within football. Do you feel that the media at the moment currently have a positive or negative effect on the way in which they cover that?
I think for me that negative press always sells better than probably positive press. I think the press have a job to relay the facts, but again, what worries me is that because we haven't got the complete facts, are we just creating panic? Are we creating a generation of players that are not going to head the ball because we've scared them, or scared parents, or us as associations have made a decision not based on any significant clinical research, but on we're not too sure, so let's just make a decision. And that's always erring on the side of caution. I don't have a problem with, but it's going to be interesting to see how this maps out over the next few years.
Do you feel that there could be perhaps more coverage given to traumatic brain injuries in terms of relaying the information surrounding it within football?
Yeah, I think, like I said to you, of these last 5 to 10 years, I think there's been a lot of good publicity around the signs and symptoms. I think anybody who's involved in the elite game or does anything with regards to the medical side of things, concussion and traumatic brain injuries is an integral part of those courses now. So we are getting better at understanding the issues, recognising the signs and symptoms, and making them decisions, and not being afraid of making them decisions. Where I know in the past people have been influenced by coaches, by managers, and possibly not made the correct decisions when players have been or have suffered traumatic brain injuries and possibly were concussed and then being put back on the field of play. But I think we're getting better. I still think we can get better, but we're getting there.
What can the media do as a whole to raise awareness of these issues?
Again, is highlight the fact that there is a lack of research. Again, we need more research. We need more funding. We need to understand that everybody needs to understand that research that is out there isn't definitive. It's not. There's no direct correlation at the moment. But again, people want to be known that there possibly could be a risk. I think it's like anything in life. If you, as a parent or as an individual playing sport, you undertake sport knowing that there's a risk, whether that's boxing, whether that's rugby, whether that's judo. There's a lot of other sports, not just football, that have a risk of injuries as well as traumatic brain injuries. So I think the public has to know what them risks are if you're allowing your child or you're participating in that sport, and then you take that risk upon yourself like you do when you smoke a cigarette or a cigar or you pick up a pint. You make an informed decision. But I think that's for me, media and research and the academia people in this world need to educate people better so that we can make a better, more informed decision.
So in terms of the media educating people and making sure that they know the research, they know the information, are there any other recommendations you would possibly make to the sports media and how to put this information across, not just articles and newspapers maybe?
I think it's making sure that we've got campaigns going on, is that people, I think the associations do a good job. We publish guidelines. I think it's always important that we get a balanced view. We understand what's out there from a research point of view. Again, it's not, is it up to the media to put out there what the universities are doing, or is that down to FIFA to communicate that? I think there's various ways. I think our governing bodies, the people that make the rules, whether that's UEFA or FIFA, have to make a decision, and I think that once they start to make the decision and from the top end, then it's easier to cascade that out to the masses, really. So it's a balancing act. I think the two have got to work together and getting that message across, and right from elite international football right down to grassroots and Sunday football and Saturday football, in the local leagues in Wales.
And there's been this link, going back to the research, there's been this link between back when players, say, playing in the 60s, 70s, were heading the ball, now have gone on to, unfortunately, come down with diseases such as Alzheimer's or dementia. And that research, some people go and suggest that it's due to the way they were playing back then, with the balls being heavier, of course, soaking up a lot more water, for example, to now the balls being technically produced so much better. Is that something that today's footballers should be worried about, or is it a case of just changing with the times?
Again, we technology, like in any sport, dictates what equipment, or like you said, the size and weight of the balls. So we've just been dragged along with that as technology's developed. It's difficult to gauge how heavy them balls were, how many times they headed it. The game's changed drastically. We have gone to a more technical game because of the way that the kids are brought up these days. And so heading, you can see that heading is far less not important. Is it not a dying art either, but it's not as common as what it used to be. So it's difficult to put on to how that influenced those players then. You don't know what else they did in life. You don't know whether they drunk, whether their nutrition had an effect from a vascular dementia. There are certainly other extrinsic factors that could have contributed to their health later on in life, and not just heading a football. It's very hard to quantify how heading a football played, what role that played in their medical condition later on in life.